The surprising effects on the prostate in older men who privately relieve their needs on a daily basis. Many men over the age of 40 continue to masturbate regularly. Some believe it helps maintain physical health, improve sleep, and may even support the prevention of prostate enlargement, but many others wonder, could doing it every day be harmful? Could it disrupt hormonal balance or silently damage the prostate? This question may sound simple, but underneath lies a series of complex biological reactions that few people pay attention to. The prostate is a small gland. Located just below the bladder, it's responsible for producing the fluid that nourishes sperm, though it's only the size of a walnut. Prostate directly affects sexual function, urination, and overall comfort in the pelvic area. If not properly cared for, this gland can become congested, inflamed, or enlarged over time. In this video, we'll take a close look at 3 specific changes that can occur in the prostate when you masturbate daily. All of these insights are based on clear biological principles and real clinical experience, and most importantly, the third change, if fully understood, can help prevent issues that many men don't recognize until it's too late. If you're in your 40s, 50s, or beyond, don't forget to subscribe to the channel to stay updated with in-depth content on men's health. And if you've ever had questions about this topic, feel free to leave a comment below. I always look forward to hearing from our viewers. To answer this question accurately, we can't just rely on feelings or personal opinions. Instead, we need to look directly at the body, specifically at 3 key biological mechanisms that the prostate is affected by when this habit is maintained on a daily basis. Part 2: 3 biological mechanisms affected by daily masturbation. Many people ask, if daily masturbation is supposedly bad, then why does the body continue to crave it so regularly, as if it were a natural reflex? The answer lies in how the prostate responds biologically, not emotionally but mechanically, when a man reaches orgasm. The level of DHT hormone in his blood temporarily drops. DHT is a powerful hormone that helps maintain male characteristics, but it's also a contributing factor in prostate enlargement when it remains at high levels for extended periods. Regular ejaculation creates short hormonal breaks, giving the prostate relief from prolonged DHT stimulation. However, if the frequency is too high, constant hormonal fluctuations may destabilize the endocrine axis, affecting the body's natural testosterone production, especially in men approaching andropause. What most people don't realize is that the endocrine system is a finely tuned orchestra. One imbalance can echo across several organs, including the prostate, adrenal glands, and even parts of the brain. Involved in mood and decision-making, when testosterone and DHT shift erratically, the body compensates through the hypothalamic pituitary gonadal axis, and this over time can lead to either suppression or overstimulation of certain pathways, affecting not just sexual performance but long-term hormonal harmony. Next, beyond hormonal factors, ejaculation also involves muscular contractions in the pelvic floor and the prostate. These movements help improve local blood flow, boost metabolism, cleanse tissue, and nourish the gland. When blood circulates well, the prostate tissue stays elastic and resists hardening over time. But if the pelvic muscles are overstimulated without sufficient rest, this can lead to tension, fatigue in the pelvic area, and reduced urinary control, particularly as men age. Long-term overstimulation of the pelvic floor without counterbalancing relaxation can also lead to a condition known as chronic pelvic pain syndrome. This is a non-bacterial issue where muscle tension and nerve hypersensitivity combine, creating discomfort and disrupted quality of life. Though hard to diagnose, it is one of the most common yet overlooked consequences of irregular prostate health routines. Additionally, the prostate is home to its own localized immune activity under normal conditions. Dead cells, excess proteins, and biological waste are partially expelled through ejaculation. This helps lower the risk of mild chronic inflammation. But if the body doesn't have enough recovery time between cycles, internal immune responses can become dysregulated. As a result, prostate tissue may experience persistent low-level irritation, causing a dull heaviness in the pelvic region even when test scans show no obvious cause. The biological mechanisms we've just discussed may sound clinical or abstract, but in reality, they've made a clear difference in the lives of many patients. I've worked with some, maintained a consistent habit, and enjoyed stable health. Others ignored their bodies and paid the price through prolonged, uncomfortable symptoms. Let me share a real case that shows just how much a small habit can impact the prostate over time. I once worked with a patient named Devitt, 65 years old, who had been a construction site supervisor in Nevada. He came to the clinic complaining of frequent nighttime urination, a persistent feeling of incomplete emptying, and a dull discomfort in his lower abdomen. He explained that he used to be very healthy, rarely sick, but over the past few years something felt off. He said he didn't feel like himself anymore. As we dug deeper, I found out that for nearly 10 years, he had stopped all activity related to ejaculation. Even with his partner, he believed that after turning 55, that part of life was no longer important. On top of that, he was embarrassed to talk about it. He thought it was too private, too awkward, so he kept brushing it off. After a physical exam and prostate ultrasound, we found that his prostate had mildly enlarged. His PSA levels were above the recommended range, and the gland tissue showed signs of mild swelling and irregularity. It wasn't a serious condition yet, but it was clear that his prostate was reacting to years of being neglected. We agreed to start with small changes. He adjusted his daily routine, added light physical activity, drank more water, took prostate supportive supplements, and most importantly, he began reintroducing a consistent ejaculation habit 1 to 2 times per week. Based on how his body felt for months, his PSA levels had slightly decreased. His nighttime urination improved significantly, and the heaviness in his lower abdomen nearly disappeared. Even more noticeable was his mindset. He was more confident, no longer avoided discussions about sexual health, and for the first time in years, he told me something I'll never forget. I never imagined something this simple could change both my body and my mindset. So much. David's story is far from rare. Many men between the ages of 50 and 70 fall into the same situation. Either they neglect their body entirely, or they simply don't know what frequency is right for them. So, what is the ideal balance? How often should you ejaculate to support your prostate without overdoing it or wearing yourself out? In the next section, we'll break it down clearly by age. Group Part 4, Recommended Frequency by Age Group. One of the questions I get asked the most is, so how many times a week should I masturbate? It's a valid question, but the answer isn't one fixed number. It depends on your age, your overall health, and how well your body recovers after each ejaculation. Here's a general guideline based on clinical observations and recommendations from urology experts. Men between ages 40 and 49 can maintain a frequency of 3 to 4 times per week at this stage. Hormone levels are still strong, and the prostate tends to recover well. Men from 50 to 59 should reduce the frequency to 2 to 3 times per week, depending on their condition. If you feel fatigued after each time or notice symptoms like difficult urination, it's best to ease up slightly and monitor how your body responds. Men age 60 and above usually only need once per week to maintain circulation, cleanse the gland, and keep biological rhythms in check. If your health is still good and libido remains active, twice a week is acceptable, but avoid back-to-back sessions. The most important principle is this: stay consistent. Don't go too long without activity, but don't push your body beyond its natural recovery limits either. This habit should go hand in hand with proper rest, balanced nutrition, light physical activity, and regular health checkups so that your entire system stays in sync. As Faye, you can see there's no need to keep a rigid frequency. What matters more is knowing your body and adjusting your routine to match each stage of life. But beyond the physical side, there's still one major barrier that leads many men to neglect their prostate health, and that's the psychological side. And this is exactly what I want to focus on as we close. The truth is, most men don't lack information. They just lack the comfort to talk about sensitive topics. Masturbating after the age of 50 is not wrong, not shameful, and certainly not something to hide, but because of social pressure and cultural judgment, many men choose silence and in doing so gradually stop caring for their prostate. I've met plenty of patients who knew something was wrong but were too embarrassed to ask. They viewed ejaculation in older age as unnecessary, even strange, especially if done alone. But once they understood that this was simply part of basic male health maintenance, just like exercising or eating, at the right time, they changed and the results were very real. What I hope you take away from this video is not just a number and not just another health tip. It's awareness your prostate doesn't need to be ignored just because you feel awkward. It needs attention at the right time, in the right way, and consistently, just like any other important part of your body. You've stayed with me this far. I believe you're someone who truly takes your health seriously. Leave a comment below. Let me know your age group and what concerns you most when it comes to men's health. And if you found this video helpful, don't forget to subscribe to the channel so you won't miss the deeper insights in our upcoming topics. Taking care of your body isn't just for the young, it's for those who understand themselves and know how to stay healthy from within.